Hello students, by this time you might have seen this post some thousands of times, but I don't want to discuss the intricate details of given in this post. But in this video I just want to share some of my views because of this minutes of the NMC meeting. There are students who are panicking for hours together. So to just relieve that panic situation, I just came up with this video. Please remember that whatever my views are, and also whatever this post by the NMC minutes of meeting is given, these are not final. Why? Because there can be changes happening in the future. You can expect even more changes, so I would rather call not changes, but these are like twists which we can see in the movie. And in particular, for the twist, I can remember this race movie. So this is no less than a race movie, the number of twists which can happen. And to know the updates about these changes, please subscribe to my YouTube channel. I will try to summarize this in a quick and simple, easy to understand way with the help of timestamps. Okay, so let us start this twisty roller coaster post related updates. So you can see in this video we are going to look at what is this news going to have its repercussions in NEET PG Aspirants 2022 and for FMGE aspirants, and also MBBS students who are joining now, who are there in their profs right now, first, second, third profs, and for also PG Aspirants 2023. So myself, Dr. Maddineni Srinivas, friends, I teach dermatology for all the NEET PG aspirants. So I have my YouTube channel, Telegram, Instagram groups. So you can join all those. The links are there in the description below. So what is that which NEET PG aspirants 2022 must do? Simple thing, pause this video, switch off the YouTube, close the YouTube app, and go back to your studies. Why? Because the exam is on May 21st and there is nothing related to the examination of NEET PG 2022 going to be discussed in this video. Only thing which I can tell you is read, revise, relax and repeat. So that's what you need to do at this point of time. Other than that, don't try to look for any updates of NeXT. Why? Because you are not concerned with the NeXT. And just in case if you want any strategy for dermatology, how to read dermatology, I will try to make a video and I will post that. So I will keep it in the iCard in the future. So to get all the latest updates, just subscribe to my YouTube channel. And coming to the FMGE aspirants, what this post has to do with FMGE aspirants? Simple, 22 FMGE is fixed. If in case your target is June or December, just continue your preparation. But for 2023 aspirants, so this particular National Medical Council post, that is minutes of meetings, has nothing to say about the FMGE aspirants. What will happen? What will be the fate of those who are doing the internship right now, or what will happen to those students who are actually studying MBBS from FMG based MBBS medical colleges and hospitals all over the world. So it is not clear yet. So all you can do is just continue your internship, continue your profs, read and write the exams and pass them, and we will try to look at the updates which can come in the future from NMC. But I have a very clear warning for all those students who wish to join the medical colleges in China and in other foreign institutions where there are only classes happening in the online mode. So this is a very dangerous sweet warning which we can say, which the NMC has actually given. Be very careful. Do not join the colleges where only online mode of teaching is being carried out for MBBS students. This is crazy, friends. MBBS students will learn the subject not from the books or not from the lectures, but they are going to learn from the actual patients. So if it is completely online, how can you get the clinical exposure? How can you be posted into the clinical departments, and how can you learn only from the books. That is impossible. So that is the reason why the NMC has come up with this. And not only that, if you are actually pursuing your MBBS from such institutions, then definitely you are going to have a hard time, because your degree might not be recognized in the future. So this could be something which you must bother about. And also one more thing, all those students who wish to join the MBBS colleges from the Ukraine, be very careful. Why? Because again, because of the war between Russia and Ukraine, there can be a situation of only online mode of education in these hospitals also. Please be aware of this. And for MBBS students, what are the repercussions which you must be aware of? First thing is the how much authentic this is actually a question mark. Why? Because few of the points which are actually there in this are definitely not looking to be original. So this could be a made up post, but few of the points are actually discussed in the NMC minutes of the meeting with various medical college all over the India. Okay, and we can see the example. We can see the example for this. So Indian Medical Association president themselves say that it is not officially confirmed, but yes, definitely they want to oppose this step of the Charak Shapath instead of the Hippocrates oath. So let us not jump into the discussion about whether it is good to change or whether it is not good to change. So our focus area is not that, but our focus area is whether this is true or false. So these are some of the points which I have taken up from the newspapers. And what is that important change which actually happened from the previously thought about guidelines, which said that the NeXT is going to be in 2 stages, but it had the idea to conduct the exam of with all the 19 subjects at the end all the 19 subjects will be tested. But I don't know, maybe they thought that it was a burden, or maybe they wanted to replicate the USMLE pattern. So somehow they have converted it into 3 stages. The first stage is going to be at the end of the second year, with the 7 subjects being are tested, and the second stage is going to be at the end of the final year. Second stage is going to be at the end of the final year. And after that you are going to join the internship, and after that you are going to write the third stage, that is after your completion of the internship, whereby you are going to be checked with the clinical proficiency and also clinical skills of the students. So just like during the launch of any satellite, there is going to be a lot of resistance. So likewise, the Indian pattern, MBBS structure of the syllabus is trying to replicate USMLE. So in this, there are going to be certain challenges, and it might be a bit difficult in the initial stages of this conversion of the old pattern to this USMLE type of pattern. And I wish that this is not going to be a very bad replica, but just like this actual classic movie Ala Vaikuntapuramlo, I just want it to be the same way, or at least a better way of presentation. Just like this movie was a classic movie, I just want the Hindi movie also, Shehzada, to be the classic, just like how it was in Telugu. So likewise, the USMLE pattern, it is a time tested pattern. So just like that, I want this NeXT also to be a good replica, at least in our Indian system. Now coming to the integrated approach, so this is very clearly mentioned in the NMC website. System wise integration is the new normal. So you can see this is the anatomy. So in anatomy there will be appendages, skin and its appendages, and also fascia, deep fascia, skin incision. So all these topics have to be included, and this is what is called as vertical integration, in which we dermatologists have to go to the anatomy class, and we have to explain these to the students in the form of lecture. So this is what is the system wise integrated approach means. And you can see in the pharmacology also, you can see that yes, anti-leprotic drugs. So yes, we dermatologists can discuss about this directly. We can show the clinical pictures and tell what will be the side effects, what will be the exact indications, and also HIV and sexually transmitted disease. These things also, apart from microbiology, these can also be integrated with dermatology. So integration is the new normal. So you can see in pharmacology again, drugs used in skin disorders, yes, we dermatologists can go and teach them in the form of lectures. And in dermatology, of course, all these metabolic disease, that is vitamin deficiencies, they can be discussed apart from the dermatologist. They can also be discussed with other clinical branches, general medicine, pediatrics, and biochemistry. So this is what is the new normal, friends. Please make a note of this. And not only that, early clinical exposure is also being thought about or thought of by NMC. As you can see in pediatrics, atopic dermatitis is a very common condition, whereby in the bedside, in the dermatology department, we have to show these students in the clinical OPD basis or in the inpatient basis. The patient has to be demonstrated, and the features of the atopic dermatitis have to be discussed in the live with the help of the patients in front of us. So you have seen these new guidelines, but in this there are so many unanswered questions. What will be the fate of the students who fail? How many attempts those students will be given further, and what is the fate of the droppers? So these things are not yet answered in these new guidelines. And also you might have known that after the NMC is formed, within 3 years there should be a next exam, but according to that, 2023 has to be the first next. But still there is no clarity about this. And also NEET UG students, please make a note of this. That is, all these norms which are mentioned in the NMC in the minutes of the meeting, they can apply to you. So from the first year itself, you be very much prepared that in the second year you might be writing this step 1 or stage 1 of the next. But yeah, no clarity of the post interns, and no clarity about the next, whether it will be conducted in 2023 or whether it will be conducted in 2024. And yes, for NEET PG aspirants of 2023, definitely it's not sure whether it will be next or NEET. That is first thing. So all I want you to do is complete your internship happily by treating the patients, and of course read, revise whatever notes you have made, or join some coaching institute, or join these kind of online apps or websites whereby you can learn the subjects by yourself. And also one more thing, you can subscribe to my YouTube channel to get all the latest updates about the exams, and also to get the information related to dermatology related conditions or MCQs. If you are having any doubts, you can join my Telegram group and you can ask all those queries. And one thing which I want to tell you is, change is the only thing which is constant. Change is the only thing which is constant. The art of life lies in constant readjustment to our surroundings. Surroundings are definitely going to change all the time. So all you need to do is you also try to change as the environment is changing or as the ambience is changing. And apart from that, all you can do is this thing. Laughter therapy can be of some help if you are having so much of panicky or anxious type of behavior. Okay, that's what you can do. And also one more thing which you must remember, it's not over until you win. Definitely do remember that. And how much ever strong the opponent or the antagonist may look, ultimately you are the protagonist, and you are going to be the winner, and you are going to get the success. So that's it in this video, friends. I hope you all enjoyed. Please do hit that like button if you have enjoyed, and you might be having these kind of friends for you in your MBBS or in your UG, those who are planning to join the MBBS. Please do share this video to all of them, because sharing is caring. And I thank you so much for watching this video till this point, friends. Myself, Dr. Maddineni Srinivas. Happy learning dermatology, friends, and happy learning medical field, all the medical subjects. Why? Because you might be a UG student who is aspiring to become an MBBS and join MBBS medical college. So thank you so much. Sarvam Sri Krishnarpanam, Sarve Jana Sukhino Bhavantu. Thank you so much.